Hello and welcome to the program. This is Health and Lifestyle. As usual, our social media handles at Marie Yambo, at KBC Channel 1 on X, KBC Channel 1 TV on Facebook. We are also on YouTube. My name is Marie Yambo, and coming up in this program, imagine using blood to treat hair loss.
When you've just started losing the hair, so you still have some hair, then you can use the growth factors.
Stem cell therapy is giving hope for hair loss. Dr. Ashni Malde explains how a groundbreaking therapy is using stem cell. And on Good Practice, it's all about hair care. For a lot of people, hair loss is more than just a cosmetic concern. It's a deeply personal struggle that affects confidence and self-esteem. Well, today we follow Cecilia, a mother of 3 who decided to tackle her hair loss in a groundbreaking way through a promising new treatment using stem cell therapy. Let's take a listen. Traction alopecia often begins subtly, but for Cecilia, it progressed over time, affecting her hairline.
I got traction alopecia, which is where you lose hair from manipulation. That is how we lose hair, because we break too tight.
During pregnancy, hormonal shifts, especially increased estrogen levels, can alter the hair growth cycle. After giving birth, she noticed more hair loss.
I am the kind of a mom who breastfeeds for a long time, and then I have 3 girls. So I would be pregnant for 9 months, breastfeed for 2.5 years, just take 6 months break, get pregnant again, breastfeed for 2.5 years. So in the course of 10 or so years, I think even the fluctuations of my hormones had taken a toll on my body. My traction alopecia became so much worse, and I could not regrow the hair.
Cecilia tried countless products and strategies to encourage regrowth.
You're told if you use castor oil, it's going to regrow. It doesn't. You try protective styling. Sometimes it's even worse. I tried minoxidil. It did work, but by the time I was starting to use minoxidil, which is a topical solution that you can use to regrow hair, unfortunately most of my hair follicles were already too badly gone. So it could not, as much as I got some results, it could not regenerate to how I was before.
Hair loss is more than just a cosmetic concern. It's a deeply personal struggle that affects confidence.
Now looking back, I can tell you for sure that most of my images or selfies of my phone are selfies to do with this side, how am I looking this side, how am I looking this side. It can take a toll on your confidence, especially because even finding a style, it is very, very difficult. These are things that you take for granted, that you can just braid your hair and hold it in a ponytail. You cannot do when your hair is starting so much back up to here. You have to find a style that can, So it's a bit difficult, and we take for granted how much issues to do with hair and skin have on your mental well-being.
As her hairline continued to recede, she decided it was time to explore a more permanent solution, a hair transplant.
I did my hair transplant about 2 or 3 years back, and basically they take grafts from the back of your head, which is where you have the strongest hair. You'll find that even the men who suffer from male pattern baldness, they're going to lose hair from here, going backwards, but at the back and on the sides you will still have hair. And that is because the hair at the back is usually the strongest. So they take hair from there, and then they transplant it, basically like the way you would do cabbages. You go from here and you replant it where you want it.
Her journey from hair loss to regrowth brought her to an advanced treatment stem cell therapy.
I've done it before. What happens is after transplant, you need to give your hair like fertilizer, so to speak. So basically what we do is that from now your body has its own healing abilities. It is not painful, but it is not painless either. It is a slight discomfort. I would equate it to like a bee sting. It's only that now there are tiny ones and there are many. The needle that they use is very, very tiny. So yes, it's still an injection, so there's some discomfort, but it is not painful.
At Tia Clinic, a team of experts specializes in cutting-edge technique using stem cell to stimulate hair growth. The therapy is designed to target hair follicles directly, encouraging natural regrowth and restoring thickness over time. The process involved collecting her own blood, which when processed would produce growth factors. The therapy is minimally invasive with a series of micro-injections to deliver the concentrated growth factors directly to the scalp. For her, this treatment is more than just about regrowing hair. It's about reclaiming a sense of self.
So when the baby was like 9 months, that is when I was like, I need to do something. And at least now I have given time now to my babies. Now it's time for me, I need to get my confidence back.
Months after her stem cell treatment, Cecilia saw her hairline transform.
I am very confident and I'm very happy with my results.
We take a break on that note, but we'll be back with much more, including a sit-down with an aesthetic doctor to explain more about stem cell therapy. Stay tuned. Thank you for staying with us. Now, stem cell therapy works by taking a small sample of the patient's own cells. These cells have regenerative properties that can activate dormant hair follicles, promoting new growth. Dr. Ashni Malde, an aesthetic doctor, explains this groundbreaking treatment. Thank you so much, Dr. Ashni. So let's start first of all by you introducing yourself.
Okay, my name is Dr. Arshni. I specialize in aesthetic medicine, and today we're going to talk about stem cell therapy, which is also known as growth factor concentrate therapy, which is one of the things I separately trained in and specialized in. And we went a step further and we now manufacture our own growth factor concentrate kits, which now allows us to do growth factor concentrate for regeneration anywhere in the body.
Okay. So we're going to be talking to, or at least the people who are watching are laymen, they have no understanding of what stem cells are, what is stem cell therapy and all that. But probably could start by just giving us a layman's explanation of what stem cells are in the first place.
Okay, so I'm sure you've heard of stem cells nowadays grow teeth, grow liver, grow body parts, because that's how advanced it's become. A stem cell is basically one of the cells in your body which will allow to regrow anything in the body. And so we diversify where we're now a bit more minimally invasive. So we're not growing body parts or growing teeth, but we're helping in regeneration of hair. So patients who have lost hair, who suffer from alopecia, different kinds of alopecia, we use stem cells. Patients who have skin issues, we use stem cells. Patients who have male and female issues, we use stem cells. Patients who have pain or anything related to orthopedics and surgery, we use stem cells. So stem cells allow to regrow that area, be it hair, skin, muscle, tissue, cartilage, not really bone, but to a certain extent, yes. Also helps to regenerate other areas of the body. And now this helps in treating the condition the patient is suffering from.
Okay, so essentially what you're saying is that there are different types of stem cells, whether it's skin, it's hair, and any other part of the body.
So today we're focusing on growth factors. There are different kind of stem cells also, different ways to prepare different stem cells. We specialize in growth factor concentrate. Growth factors are the most original version of stem cells because they come from your own blood. And so growth factors, when re-injected in any area of the body, will help regeneration. So the growth factors are stem cells, best version of stem cells, and that will help to regrow anything in the body.
And like you rightly put it, so we're going to be talking about regeneration of hair. So in this case, probably we could start by just understanding what are some of the contributing factors to people having, can I say, hair loss before they can actually come for this kind of treatment?
The biggest concern we see in females in Kenya, or I would say African females, is something called traction alopecia. Traction alopecia comes from the braiding, the weaving, which is years of pull, and that pull is what allows or what causes the hair to be lost. So you'll often see that most African females lose hair bandwidth, which is just in the front, as opposed to when we talk about general balding, which is also a form of alopecia, known as androgenetic alopecia or androgenic alopecia, that you will see people start balding from the center. And so traction with females is the most common alopecia. That's where we help the women to regrow their hair. It could be through the stem cells or the growth factors, or sometimes a hair transplant. The second one is the androgenic alopecia, which is just actually balding. Balding can be because of anything: age, genetics, lifestyle, stress, majorly those concerns. And so that will cause balding, what we say kipara. Mm-hmm. And otherwise, there are other different types of alopecia as well, which are alopecia totalis, universalis, alopecia areata. But these now have different treatments. Not a lot of people suffer from these, so they're less common as opposed to the androgenic and the traction.
So at what point does somebody come in for stem cell therapy for hair regeneration, and when does somebody go for transplant? Because there are cases where the stem cell therapy will work even without a hair transplant. But then again, there are situations where you have to go for a transplant now and then come for the stem cell therapy. Maybe you could explain to us.
So just when you've started losing the hair, and let's say you have some hair but you've not lost all of it, is when you will benefit from stem cells or growth factors. But when you've lost a certain amount of hair, which we generally tell either using a dermoscope or we visually tell just with our experience, then we know that you're either an ideal candidate for the growth factors or for a hair transplant. So when you have hair thinning, that is when now you are an ideal candidate for the stem cells. Also, the same case with the androgenic alopecia. So when you suffer from traction alopecia, when you've just started losing the hair, so you still have some hair, then you can use the growth factors. Likewise, when you have the balding that happens, you'll still see some fine hair. So that's when growth factors will be beneficial to you. When the hair is lost 70, 80%, 90%, or completely gone, that's when you're an ideal candidate for a hair transplant. Mm-hmm. But however, when you do the hair transplant, we will still do the growth factors post hair transplant because now it behaves as a fertilizer. All have 100% growth factors, but because of sometimes the different types of tubes that are being used, we don't achieve the 100% growth factors once the blood has been processed. Sometimes also age, ailments, long-term chronic ailments, which are skin, which are health issues, also affect the growth factors that are processed. However, that's why I specifically showed this tube, because the growth factor concentrate gel, which is a thixotropic gel, allows 100% extraction of the growth factors. And so no matter the patient, the age, the ailment, or even any condition with the patient, we'll be able to have 100% growth factors. And when we have 100% growth factors, we have 100% results. Okay, so we've collected the blood in the tubes. Now this blood is going to stay in the tube for 30 minutes. This is where the activation of platelets happens. and the extraction of the 100% growth factors happens. So I'll explain this in layman term. It's like getting orange juice from an orange. When you manually extract orange juice with your hand, you'll get only 40 to 60% orange juice from the orange. But here, because it's staying in the tube for 30 minutes, we're extracting the orange juice from the machine. So the entire orange or the entire platelet goes in, gets extracted, and we get 100% growth factors. So this is going to stay here for 30 minutes, and then we're going to put it in a machine where we will separate all the other blood cells, which are red blood cells, white blood cells, pus cells, even the platelets, so to say. And now this gel will move to the middle, I'll show after, and then we'll only have 100% growth factors on top. And we're using the stem cells or the growth factors just to boost the transplanted hair. This transplant was done about 2 years ago. The hair is fully grown now, so this is just a maintenance, which is more like a fertilizer to the grown hair, just to assist in maintaining that hair the way it is.
Okay, so if you remember, we initially took blood that was all the way up till here, and the gel was at the bottom. We've processed it now, and you can see this golden color fluid. This golden color fluid is the growth factor concentrate. This is what we are going to inject back in her hair. So I'm going to start now by just cleaning the area. We're using a surgical spirit to just disinfect the area. I'm going to start now. I want you to relax, keep deep breathing. Basically, as I mentioned, it's a walk-in, walk-out procedure. The patient is very comfortable to go back to work or continue with her daily lifestyle. Sometimes in the very first session, patients will experience some amount of pain, and so we do advise them that they can just take a painkiller. Something as good as a Panadol is fine. It doesn't have to be too strong. But that's only if they feel that the pain is there. They often will complain of a headache the same day in the evening, and the Panadol is completely okay to take. But if the patient can bear it, I ask them just to bear it, because they'll be completely fine the next day. We rarely have patients who complain of pain that lasted even more than a day, or that carried on to the next morning, or patients who would come to complain about inflammation, swelling. None of that happens. So the only thing the patient is not supposed to do is not wash their hair for today, or at least the next 24 hours. But otherwise, no do's or don'ts. They can just go back to their routine lifestyle.
So what are some of the good practices that you can inculcate to actually stop traction alopecia or even postpartum alopecia? Well, traction alopecia is preventable, and some of the ways that you can do that is avoid tight hairstyles, as the excessive tension and stress can damage hair follicles. Also keep traction hairstyles for a short period, well, a maximum of at least 2 weeks, and such hairstyles should not be worn, that is, frequently. Adopt a regimen that includes gentle shampooing and conditioning, and also avoid the use of heat and hair relaxers. And in as far as postpartum hair loss is concerned, there is no treatment for postpartum hair loss, but these steps can help you prevent further hair loss and damage. Number one, choose a shampoo and a conditioner that adds volume, and be gentle when washing and combing your hair. Use lower heat settings on blow dryers or styling irons to prevent damage, and also avoid tight ponytails and braids that can add tension to your hair and lead to more hair loss. Of course, diet also plays a very big role. A healthy diet can help maintain and promote hair growth, so ensure your meals are balanced with proteins and vitamin Bs. Vitamin B6, B12 and folic acid are important for hair health. You can also find B6 in bananas, potatoes and spinach, while B12 is found in meat, poultry, fish and dairy products. Folic acid is found in fresh fruits and vegetables, especially citrus fruits and tomatoes. Well, biotin, this is the nutrient that helps produce amino acids which form proteins. Lentils, or what we locally call kamande, are a good source of biotin. but you can also find it in carrots, almonds, walnuts, and cauliflower. Vitamin C helps to maintain and repair skin, bones, and teeth, while blood vessels and connective tissues. You can find it in oranges, orange juice, peppers, strawberries, broccoli, and even potatoes. While zinc and selenium, these minerals are important for scalp protection. A lack of zinc can lead to hair loss and a dry, flaky scalp. And selenium works as an antioxidant, which helps to protect against the effects of aging. Omega-3 fatty acids is also one of the nutrients that you can ensure to put in your diet. But all said and done, see a doctor or a dermatologist for that matter if the problem persists. Thank you so much for your time. That's where we come to the end of this program today. And of course, this program would not have been possible without the inputs of Cecilia, who shared her story with not only postpartum, alopecia, but also traction alopecia. And of course, Dr. Ashley Malde, who actually explained to us how, stem cell therapy works. And of course, the team, the entire team, the producers and the directors. Thank you so much for your time. My name is Marie Yambo. Remember, if you've missed any part of this program, you can always catch it on our YouTube channel.